Hello, everybody. This is. Hello, everyone. This is. Are we. Okay. Sorry. I was thinking for some reason. There we go. That it was paused for some reason. I apologize. There we go. Okay. So this is all about joints. And so I wanted to show you a picture of a joint. But I also am going to write down your three types of joints that we have. So a joint is an articulation. Now that's a fancy word. Now if you remember articular cartilage, that's important because that was talking about the hyaline cartilage. Well, this is anywhere two bones meet that you have a joint. And some joints are more flexible than others. So we're going to start with some of the least flexible ones. So one of the first one is called a fibrous joint. Okay. And the fibrous joints are going to be that exactly, fibrous. It's going to be made, has lots of dense connective tissue. So, oh my goodness, we're coming back to chapter 5 again. So, dense connective tissue. Look at, I can write off the paper. There we go. Dense connective tissue. So, this would be between the flat bones, so like in the skull. So when you're thinking about like the fontanelles, that would be kind of what those joints are, so fibrous. And if you stop and think about that, those aren't very flexible. They're a little bit, but not a whole bunch. This is also between, they say, in the leg between the distal end of the tibia and fibula. So I like to mention that one. And my board is, there we go. Come on now, board. Let's get this together. It's not going to let me tibia and fibula at the end there too. Okay. Questions on that's not too hard. If you think tibia, distal. So distal end. Another type of joint, a little bit more flexible, is cartilaginous. So cartilaginous joints a little bit more flexible because of the cartilage going on there. This would be the intervertebral disc. Intervertebral disc. I'm going to call it an IVD, an intervertebral disc. Okay. Between each of those, a shock absorber. This would also be the pubic symphysis. You're like, where is that? Pubic symphysis or symphysis pubis. I've seen them actually both ways. This is where the two parts of the pelvis meet right in the center. Remember how I said that the hips can rotate? Well, that center part is also just a joint, joining both right and left portions of the pelvis. And guess what? The last one is the one that you see here. So it's a synovial. And way back, I can't write on this bottom portion for some reason. So synovial is the last. So we have cartilaginous, synovial, fibrous. Synovial is, of course, the one that's found everywhere else. So this would be the example of the synovial. We mentioned the membrane synovial when we were doing skin, and we talked about serous and mucous membranes, synovial membranes, and then we said cutaneous, which was the skin. So this one is talking about this joint, and this just this could be I would say more than likely this is the knee. This is of course the bottom of the top of the tibia, bottom of the femur, even though that bottom of the femur doesn't look quite right. And of course, remember there'd be a big fat patella right over the top of it. So notice we have articular cartilage here. Okay, articular cartilage. And I'm also, along with this, I'm going to attach this page with Skyward. So you have articular cartilage on the end, so they are separated. And then you have this area called the capsule that runs over top. Do you have to know all this? Yes. It like skips right there for some reason. And within, so you have the joint capsule, which is really kind of made up of outer ligaments and things like that, outer layer of ligaments. And then you have the membrane, which is inside. So see this red area? I guess, let me see if I can get a different color here. So this part that's lining over top here, this very little lining here, is the synovial membrane, which is secreting a fluid. Okay, the synovial, so this cavity is filled with fluid. So if you stop and think, holy cow, that's not really a lot of space for a bunch of fluids. So you can see, think about your knees and how much you wear and tear on your knees. It's pretty amazing that after all that you have anything left down in that area. Okay, but you can see where people's cartilage end up rubbing on one another. Where if one is dislocated, you can see where you can get damage or an abnormal amount of fluid. If you get swelling in the knee area, I'm sure many students with knee injuries have had swelling, then this joint is not movable whatsoever. It's pretty terrible. So that was the example kind of just a regular joint. And yes, you have to know synovial membrane, articular cartilage, synovial cavity, and capsule. Okay, so let me page down. I'm going to come back to osteoarthritis in just a second. So I want to go to this area here for just a second. Okay, so this part is talking about two extra things that we have. Here's the bottom of the femur. This is anterior, so there would be a big kneecap right here. But if you take that away, here's all of the, right here, like ligaments here. So since this is the fibula, so this would be the lateral, this would be the LCL, and this would be your MCL, medial cruciate ligament. You don't have to know those, but when you hear those terms, the one in the back would be your PCL, and the one in the front is your ACL, which you hear more about the front one, the ACL. I think one of those, to me, I probably damaged. My kneecap went laterally, so I'm sure that my LCL was damaged, but the doctor said until it pops out a few more times, they're not going to do anything about it. Isn't that lovely? So you have these things called menisci or meniscus. So you have two things. So you have meniscus or menisci, and then you have bursa. Okay? And so this is on page 163. Menisci is extra pads of fibrocartilage. So pads of fibrocartilage. Now, why would you think pads of fibrocartilage would be a good idea at the bottom of the knee on top of the tibia? Well, let's think about this. Shock absorbing. So exactly. So in certain joints, you have some meniscus. Can your meniscus get worn out and damaged? Absolutely, especially in the knees. Bursa is a fluid-filled sac. Fluid-filled sac over bony prominences. Okay, so do you remember we talked about like ulcers and things? So this would be on places where the bones stick out, where you would want some extra coverage, where you would want a burst, like an extra so the skin isn't rubbing. I thought I had a picture of that, but I don't. Bummer. The shoulder has lots of bursa. So yep, and I don't even have anything. So you can look up bursa in your textbook. Actually, let's see. Figure 164, there is bursa right over the top of the patella on the front. Because you think about it, otherwise it's bone. You probably don't feel it, but if you lay on top of your, or kneel, it would certainly be in that area. Okay, so with that being said, let me go back. And I want to kind of highlight on I'm going to highlight on this because this is talking about a normal joint, osteoarthritis and rheumatoid arthritis. Osteoarthritis is talking about bones rubbing together. So this is actually, so you end up with bone on bone, and osteo means kind of an old age thing. So this is thin cartilage that happens, or you know, it's wearing away. And this picture looks different than this one, right? You have lots of swelling going on here. Rheumatoid is really referring to like inflammation. So on page 165, and I'm writing with my mouse, so be patient with me. On page 165, you have two things. They talk about rheumatoid and osteoarthritis. So rheumatoid is actually an autoimmune disorder where the body starts to, it's very debilitating, but it starts to break down those joints. It attacks the joints and makes a lot of swelling going on. I'm sure you've heard of like osteo, biflex, sometimes of those. I'm not sure if I've heard about a lot of rheumatoid arthritis medicines going on. But your articular cartilage is going to be damaged because of the movement, very limited movement. But that's not an old age thing like osteoarthritis is. Osteoarthritis is definitely an old age, a degenerative disorder. You can inherit it. It may appear in the 30s, but more than likely it's just because you've used your joints a lot. And this starts to wear away. And it usually happens in the knees and the joints. It can be in the shoulders too. So it can be actually pretty painful. Two of the I guess diseases, what I would say with your joints. Okay, and here's your joints. Okay, so here's all the different types of joints, and I say hinge because remember I said you're going to know most of these already. I mean, this is kind of, I can't remember what grade in elementary school, but I remember learning these. So we have pivot. The neck is a great example of a pivot because you're pivoting, and I love the pictures here. We have hinge, the ulna to the bottom. Remember the ocrine fossa? That would be a hinge joint, so a back and forth. Your knee is also a great hinge joint because you can't move it either way. A lot of your fingers would be a hinge joint. Some of your fingers are a hinge. Gliding, that would be your wrist. Your bones in your wrist are a gliding joint. And ball and socket, of course, that would be the shoulder and also the hip, most movable joint. The saddle. Now, remember I had you learn the trapezium. Well, that's because it forms the saddle joint. That's the example of the saddle joint. So there we go, the trapezium. And then the last one is a condyloid, which is probably the only one that you don't know. And the condyloid is a weird one. The condyloid is like an oval-shaped condyle on one bone, fits into the elliptical cavity of another. So between metacarpals and the phalanges, rotate, it says, rotation is not allowed, but it's more of this type of joint permits a variety of movements in different planes. Rotational movement, however, is not possible. So you can't rotate if you think about it. You can move, but you can't rotate it. So there's all your joints. That was pretty easy. They give you some other examples, but those are the main ones. And the last one is types of movement. So here's some pictures that we have. And so I'm going to kind of write over it since it's a little fuzzy. So this is flexion. These are on page 166, 167. This is flexion when you decrease the angle between a joint. So flexing, you can, and this is any sort of kind of bending of your foot or flexing your arm would be that. Extension is going beyond. What they didn't show here is hyperextension. So this would be like bringing your foot like this and causing this to become a bigger angle because I hyperextend. So think about your leg kind of forming if you're standing from the side, somebody's leg kind of looking like this. And here's their hips. So their knees kind of go backwards. Girls, I notice, tend to do this with their elbows. Okay. Adduction and abduction. So abduction is taking away, like you're getting abducted, okay, kidnapped. And adduction is bringing it in. It's funny because the inside of your thighs have abductor and adductor muscles. And if you do this motion, you'll notice that you'll get some owiness out here, and then you'll get some owiness in here if you're working it right, okay? Rotation is just moving your arm, so rotating at your wrist, rotating your neck, rotating your arm back and forth. That is another one that I have you learn. And then the last one is eversion. Oh, okay. I don't have you do this one. Okay. I don't do pronation and supination. This one is inversion or eversion. So this one is a little bit easier. Turning the foot so the sole is outward, and then inversion is turning it so the sole of the foot is inward. So rolling your ankle inward, so your bottom of your feet are inward. Like if you were sitting in like a butterfly position, or turning your feet outward. Okay, that one's kind of a different one. And then we need, that's not written down, we need retraction and protraction. I'm sorry because my board died on me here. Think about like thrusting your chin forward, or how about taking and sticking your lips out, like for a kiss would be protraction, so out, and then retraction is bringing it in. Okay, and the last one is elevation and depression. So elevation going downward, and or elevation is going upward, and depression is going downward. Like squats would be depression, and elevation would be standing up. Okay, but several of these movements, by the way, let's see, the soles inward would be, so this is the in version, and this is E version. So I wanted to make sure you understood that. So there are several on that stick figure diagram. There are several that you could say they are, and so we'll discuss that together on Monday. Okay, and this is it. They read about, or they talk about arthroscopy on page 167, which is really good. So make sure that you check this out and listen to this. Thanks.